I think that we have a bit to demystify the fact that humanitarian workers are heroes and are untouchable or unbreakable. As an emergency medical organization, the humanitarian workers are exposed to the death of our patients, to the limitation of means and equipment that we can have, to the large scale of problems that we can face. This is part of our world. This is also part of what we choose to do. This doesn't mean that it is easy.
When the first wave came, there was very little knowledge of the disease, what COVID actually is, how it is transmitted, what kind of PPE do we need to protect ourselves and the healthcare workers, how can we treat it. So there was a limited amount of knowledge. It was extremely difficult to move people across borders suddenly, or material. And that confronted teams to situations where they've seen immense need to intervene because people had COVID and were really sick and needed hospital care, sometimes intensive care, and we were not able to provide.
We had to adapt to this unknown. We had to adapt to the lack of control on our lives and on the choices that we were used to make. We realized that it is not easy. There is still a lot of stigma on mental health, and I think that the COVID helped to talk about the problems that people can face in their normal life.
If these situations, these experiences of moral distress are accumulated one after one after one, it can in that sense lead to very strong frustration and burnout, and that is then a condition that would need psychological support. The accumulation of moral distress in individuals and in teams has an impact on the quality of care we are able to provide. And that is a very clear link. So the more we work in supporting individuals and people to deal positively with moral distress, the better our quality of care will be as well.